Welcome to the clinic. You're probably here because you're looking for an alternative solution to your knee pain. If you're looking for a practitioner who addresses the underlying cause of your knee pain and uses a no stone unturned approach, then you have come to the right place. We're able to help people avoid or lower their dependence on pain meds to manage their condition while restoring function back to their knee. We're excited to start out our educational process with you. Now let's get started. Knee pain is one of the most common and disabling degenerative diseases in the United States. Did you know that in 2008, 30% of adults in the U.S. reported having knee pain? Since then, those numbers have only risen. In 2014, there were 93 million people in the U.S. suffering from knee pain. Many people rely on the use of NSAIDs, non-steroidal anti-inflammatory drugs, to manage their knee pain. However, these drugs are not without side effects and risks, just like any drug. There are 107,000 patients who are hospitalized every year for complications related to NSAID use, and there are at least 16,500 NSAID-related deaths that occur each year among arthritis patients alone. The number one cause of joint degeneration is an abnormal body mass index, meaning overweight or obesity. In our program, we will be addressing all underlying causes that are accelerating your degenerative knee pain. Many people think that knee pain and joint pain are just an inevitable part of aging. But our bodies are not naturally programmed to just have our knee joints degenerate with age. Through our multifaceted approach, we will be leaving no stone unturned with your condition, making sure you're a good candidate for our program. Knee osteoarthritis, or knee joint pain, is one of the leading chronic degenerative diseases in the U.S. Millions of dollars is spent on knee replacement surgeries, dangerous injections, and medications every year. The problem we have in our conventional medical system with treating knee pain is that we rely on drugs, surgeries, and cortisone injections to try to fix the problem. But these are all acute care approaches, which means emergency care. Osteoarthritis of the knee or knee pain are chronic degenerative conditions. They do not need to be treated with an acute care approach. As chronic conditions, they require a systematic approach to correct. We have a saying in our office, if nothing changes, then nothing changes. Meaning, if we don't start doing something differently, we're going to get the same result we've been getting over and over. When it comes to knee pain, first we start with medications, then the pain gets worse, so then we try another one or we increase the dose of the one we're already taking. But the condition continues to get worse because the underlying cause is not being addressed. We may then go do some rehab, maybe get an injection here and there, but still nothing changes and the underlying condition continues to get worse until we're a candidate for surgery. Arthritic knee pain is a chronic degenerative disease, which means it progresses. There are no medications that slow down osteoarthritis of the knee or knee pain causes. If you're taking medication and you've been doing this for years, maybe even decades, what could possibly change? The trends we're seeing are higher and higher dosages of medication and increasing knee replacements. Or you may be at this visit today because you're being proactive with your health, trying to do something different and avoid this route altogether. You likely already know that any medication you may take for your knee pain is going to be accompanied by a host of side effects. We're not going to spend a lot of time on this because many patients are already well aware of these facts. Listen, we're not telling you to stop taking your medications. For those of you out there that can't walk without them or can't stand the pain, can't sleep, can't function throughout the day, if you can't do the things you enjoy, we certainly don't blame you for taking medications so you can live your life. Our job is simply to educate you about alternative options to recovery that address the underlying causes. And also to educate yourself about the medications that you may be taking. You can always go to WebMD, look up the drug, and be informed about the side effects of those drugs you've been prescribed. Using them in the long term is never the ideal answer. What medications do is trick your body into telling you that you feel better than you actually are functioning, allowing your knee to get worse and worse over time until you qualify for surgery. Again, there is a time and a place for medications, but they are never ideal in the long term. Your doctor cares about you just as much as we do, so it's not your doctor's fault. It's the system itself and the options it offers to patients. The ultimate long-term option the conventional medical system offers is a knee replacement. You may be surprised to hear that there is a lot of overlap between what is treatable in our clinic to an orthopedic surgeon clearing a patient for surgery, meaning that we've had patients being told they needed surgery, and we were able to stabilize them back to daily function. You have to remember, most doctors have 1 to 2 tools in their tool belt to treat knee conditions. Medications are the first step, and surgery is the next. Knee surgeries have long and short-term consequences. The average knee surgery costs $75,000, and that doesn't even include the 6 to 12 weeks of post-rehabilitation, which can take valuable time away from your work and your family. Did you know that we treat our bodies worse than we treat our cars a lot of the time? Well, if you don't believe me, let me ask you a question. If you were driving in your car and your check engine light came on, what would you do? Well, exactly, you'd probably take it to the mechanic. They would pinpoint the internal problem, and they would fix it, and the light would go off because the internal problem had been fixed. Pretty simple process, really. Well, what if I were to tell you that the last time my check engine light came on in my car, I drove it to the mechanic and just asked him to reset the light for me so that it didn't bother me anymore while I drove? That doesn't make sense, does it? Yet, this is exactly what we do with our pain when we take NSAIDs, pain pills, get steroid injections so that the symptom goes away. The medications reset the natural pain response, which is like our body's check engine light. They tell it to go away until the medication wears off, and then the pain comes back. By doing this, we never address the underlying cause. The internal problem continues to grow and grow and grow until we have not just a small problem on our hands, but a huge problem. It's just as if I were to reset my check engine light or even put a piece of tape over it to cover it up. I may have fixed the symptom, but the underlying problem still remains. So the next time you experience balance problems, burning pain, sharp pain, it's hard to go up and down the stairs, you feel unstable when you walk, you feel like your knee's going to give out, or you just can't perform the activities that you want to in life that you used to be able to do, realize that this is just like your body's check engine light is coming on, and you might be reaching into your glove compartment and putting a bandage over it. So what do you think's going to happen if you keep doing that? Well, the internal problem is going to keep getting worse and worse and worse until it gets to a point of no return. You have to ask yourself, where will I be in 1 year, 5 years, or even 10 years if I keep doing the same thing? So let's talk briefly about the knee joint. In a healthy knee joint, you want to have a healthy spacing between the two bones. This allows the cartilage plenty of space to function, and the healthy fluid is also there for protection of the joint. When the knee joint starts to be compromised is when problems start to occur. When the integrity of the knee joint starts to break down, the mobility of the joint starts to decrease. Daily activities start to become more difficult, and the degenerative process really starts to set in and gain momentum. This is when you start to notice limited mobility, increased pain with normal daily tasks like walking, going up and down the stairs, getting up or sitting down, and just a general lack of confidence in your knees in your day-to-day activities. The good news is, we can help patients stop this degenerative process early, and we can even help patients who have waited years to do something about it. The doctor will be able to determine how much we can help you, and if you're a good candidate for our program or not. Let me give you a simple analogy to explain how the breakdown of the knee joint occurs. I want you to take your hands and put them together and then rub them together as fast as you can. Take a minute to do that right now. Do you feel the heat and friction between your hands? Well, imagine doing that for a really long period of time. Eventually, your skin would start to break down. The texture would start to change. Everything would become really dry, like sandpaper, just as your knee does after it breaks down. This is exactly what's happening to your knees as they go through the degenerative process. Next, I want you to think about something. Why is it that people at different ages have knee degenerative conditions? Why is it that usually one knee is degenerating faster than the other? Something to think about as we go through the rest of this presentation. Let's start thinking about what the 3 crucial components are of degenerative knee conditions. Our bodies are complex, just like a sports car. In order for this car to operate, function, and win races, it needs a few things. Number 1 is proper alignment. Number 2 is proper fuel, filtration systems for the fuel, oil, and oxygen flowing through the engine so everything stays lubricated and moving properly. Number 3 is the car has to have a strong frame with fully functional parts, carrying no extra weight wearing out the shocks, struts, and mechanics of the car. Our bodies work much the same way. Let's talk about how this relates to your body and your knee condition. There are 3 components that need to be evaluated for your knee pain so we can get you optimal recommendations and results. The first is a structural component. This is the same thing as a car needing a strong frame in order to complete the races. The second is a neurological component. This is the same thing as the car needing an effective engine, fuel pump, and parts. And the third is a metabolic component. This is the same thing as the car needing great fuel, oil, and light weight for optimal speed. Each one of these is equally important when evaluating and treating degenerative knee pain. If you've been to other offices, chances are you did not get all 3 of these evaluated. Let me explain each one of these components next. In most clinics, it usually starts and stops with the structural components. They take a couple of x-rays, they look at what they see, and then they say, "Oh, you have osteoarthritis in your knees. Here's a prescription for the pain." Or they say, "We can do a cortisone injection for the pain, but you only get 4 a year because they're not very good for you." Or "You're not a candidate for surgery yet, but we can send you to rehab until you are." As you can see on the left, we have a normal knee with spacing in between the bones. That spacing protects the knee joint. On the right, you see a joint that is just bone on bone. Obviously, this is going to cause friction and will cause a lot of problems. Anything in between the image on the left and the right is degeneration and needs to be addressed. Structural changes in our posture and spinal instability will cause weight to be shifted onto one side, wearing out the joints on that side, causing them to age faster than others. This is commonly why one knee hurts first, and then the other starts to hurt later. The body will shift weight from side to side to compensate for injured areas, which in turn causes more problems later on. This causes nerves to be compressed and muscles not to get the signals they need to stay strong and supportive. When we have lower back problems, those lower back nerves that travel down to the supporting muscles of the knee get compressed, causing them to weaken, which will in turn cause the knee joint to collapse. We don't necessarily have to be feeling pain in the lower back for those nerves to be compressed. Only 10% of the nerve perceives pain. The rest of the nerve can have other functions, like supporting the muscles that support your knee. As you can see, the neurological component to your knee problems is very important. The important question is, has this ever been tested before for you? If we can identify compressed nerves that control your knee supporting muscles, along with decreased sensory activity to the legs, we know this component is feeding into your knee condition and needs to be addressed. The third and final component is the metabolic component. You may be thinking, okay, what does my metabolic health have to do with my knee? Well, great question. It actually has a lot to do with your knee condition. Let me explain. According to the Mayo Clinic, every pound of extra weight we carry is like 4 extra pounds on the joint. So you can only imagine the stress we put on our joints if we're carrying an extra 10, 20, even 30 or more pounds. The Mayo Clinic attributes this as the leading cause of joint degeneration, including the knees and the lower back. You might be experiencing what's called leaky gut syndrome, even hormonal imbalances or thyroid issues. All 3 of these come with a host of overlapping symptoms, such as bloating when you eat certain foods, constipation, diarrhea, fatigue, thinning hair, anxiety, adrenal gland issues that zap your energy. The list goes on and on. What do all of these have in common? Well, they all feed an inflammatory response to your knee pain, which slows down healing. Have you ever had days when your knee pain is worse than others? Well, the weather was the same, you did nothing different, there was no rhyme or reason to why your knee hurt worse. That's the inflammation response from abnormal metabolic function. We'll be going over this in your evaluation process. Now that you understand all the components to your knee condition, you should be excited. We have a plan that works, most importantly. Once the practitioner meets with you, they'll determine which components you may have working against you and your degenerative knee condition. This comes directly from our patients. If you've been told before that there's nothing that can be done, you just have to live with it, I'm here to tell you today that that is absolutely not true. Once you start addressing the underlying causes of your knee condition and fixing them, the body knows exactly how to repair itself, and start enjoying life again. The doctor you've chosen today has made the conscious choice to address the underlying cause of your knee problems so you can have long-lasting results. They have specifically chosen not to take the reset the check engine light approach. A practitioner will be in with you shortly to start the qualification process and see if you're a good candidate for our program.